There is a great push now for some type of national health service, national health care. The United States is the only Western capitalist country outside of South Africa, if you consider that an advanced Western capitalist country, which doesn't have some type of comprehensive health care system. Are the libertarians for this, or are they against it?
Well, we're for a comprehensive health care system, and we want everybody to have major medical coverage and the best insurance and the best medical care. That's why medical care has to be delivered by the free market. If we don't care about medical care and quality, if you like lines, and if you like the medical care the Indians get, and if you're happy with the Veterans Hospital, and if you're happy with how England runs things in the Soviet Union, then I guess we need another move in the direction of socialized medicine. Government now, even though we don't have a major national program, government now delivers 60% of the health care in this country. The more we spend, the higher the costs, the lower the quality, less people can get the care. I mean, it's a lousy delivery system. Poor people who can buy their TVs and cars and video cassette recorders have no health care. They buy the VCRs and their television and the cars in the marketplace. They get their health care through government program. With all this spending, there are still 38 million people who have no insurance whatsoever. Just devising another government program which won't work, but just further push up costs and put controls and more doctors dropping out. And I think it's a total disaster. If it's a national health program run by the government, it's tragic. It won't work. It's going to ruin the care in the country. If we care about people, we will have a national health care program, but it will be delivered by the free market.
But the free market is what we have now. We have bad health care. We have a greater percentage of GNP being spent on health care than those places, than those countries where they have a government-sponsored system.
I don't agree. I don't think that we have free market medicine. As I said, it's 60% is paid by government. We have coercive rules that force governments into these HMO organizations. Government, the large companies had to offer these things, so they've been growing and now going bankrupt. And when you pump a lot of money in, if government's paying the bills through Medicare or Medicaid, this doesn't spread the money out. A lot of wealthy people get the benefits. The poor people don't seem to get through the the maze of papers, but a lot of millionaires receive Medicare benefits, so they get their hospital payments. But when they go in and pay and have a little insurance, what happens? The hospitals and the doctors and the labs tend to jack up the prices. So, and then the government has to come in and say, well, we're going to put on controls because the prices are too high, and then we're going to ration care. So one problem leads to the next. But the problems you see today are a result of 50 years of ever increasing government intervention in medicine. The government doesn't pay for 60% of our automobiles, but they pay for 60% of our medical care. The automobile prices are high, but they're not as high proportionally speaking. Cost of automobiles is going up at the rate of about 4 or 5% a year. The cost of medical care is going up about 15 or 20%. Government's in education. They're in college education. They're always subsidizing college education. Always the guy that doesn't get to go to college has to subsidize the guy that gets to go. Cost of education is going up about 15 to 20%. So as soon as you get government involved, quality does not go up, but the cost goes up, and there's not any fair distribution.
Where do you stand on the right to lifers? Are those folks like you, the anti-abortion people like the libertarians?
It's mixed. They like me because I am a right-to-life libertarian. I believe killing a fetus is an act of aggression. I've been forced to be in a room, unfortunately, when I saw a 3-pound fetus, infant, taken out, breathing and crying, and thrown in a bucket. I mean, I take my pledge seriously. I mean, that to me looked like an act of aggression. Besides, if I give the wrong medication as a physician to a mother and I damage the fetus when it's born can sue me. Obviously, it was legal, alive and human, or it wouldn't be able to sue me. I know the fetus determines its inheritance rights at the time of conception. So I'm in disagreement with our platform. But there were enough libertarians who agreed with my position that I won on the first ballot at our convention. The truth is, it's a difficult issue, and nobody likes to think about it because the way the law states now under Roe versus Wade, the fetus 1 second before birth at the weight of 9 pounds still has no legal rights, and nobody enjoys defending that position. very difficult, because I, as a libertarian, I don't like to interfere with the privacy of a woman either. But how are we going to deal with this? I think we have to have respect for human life, or we can't have respect for individual liberty and the right to smoke a cigarette.
So you think the government the government has the right to force a woman to carry a fetus full term then?
Well, I think the government has the right to protect life. It's sort of like saying if the baby's born and the IQ is 65 and they want it 100, does the government have the right to force that person not to kill their baby? Yes, I do think so. I think the government has a right to protect life, but the government doesn't have the right to force anything. So it is difficult, obviously. But I think the bottom line is killing a fetus an act of aggression. And the only way the libertarians or others who disagree with me on that, they would have to say that no, it's obviously an act of aggression. There's no debate there. It's that the fetus is not a person. The fetus is not alive and it's not human. And I, as a physician, have a lot of trouble with that. I mean, I know it's alive, I know it's human, I know it's legal. So this is very unique, and I don't advocate any federal laws. I don't even, we libertarians nor this system that we have advocated federal laws to deal with theft or murder or anything. It's all handled by the states. So I think that the states would handle it differently. I think courts would handle it differently. I think juries would handle it differently. But I think under my ideal situation, we wouldn't have people having abortion on demand and using it as birth control and having a callous, careless attitude about life, and instead of having less illegitimate pregnancies or births, illegitimate or unwanted pregnancies, now it was intended to help difficult situations. But what it has done is that the teenager sometimes can have 3 abortions in a year, which is sad, and it's a tragedy. And I've seen the tragedies, I've witnessed them, and I have great empathy for them, but I also have great respect for the principles of freedom, and I don't want to infringe or compromise my concept of what liberty is.